Please feel free to replenish your plates or your beverages, but we're going to get started. Just a brief explanation that the community breakfast is put on by a collaboration, and it's sponsored by the Family Support Center, the Court-Appointed Special Advocates, which is CASA, DHHS Foster Care, and the very great START Collaborative at the BISD. We have felt it's important that we bring topics quarterly to this area so that people can be aware of the services, whether they're new or they're old, and we just need to be reminded of what's being offered. Our guest speakers this morning will be Nancy Ludwell from My Alpha Place, Abigail Lynch from Barry-Eaton District Health Department, Sue Eastman from Pine Rest, and Laura Myers from Barry County Community Mental Health. They've put together a very timely and important presentation for us to learn more about what's available for our moms in the community. So we're going to start off with Abigail.
Good morning, everyone. I am going to be probably the quickest part of this presentation today. I just wanted to explain a little bit about why we're here. The health department gets funding from the state every year to address issues related to maternal-child health. And this past fiscal year, one of the health indicators that we looked at was postpartum depression. We looked at the rates of that. We found that generally in Michigan, the rates are pretty high, and so we decided that we'd like to do something to address that in Barry County. So earlier in the summer, I think it was in May, we held an event for providers at Spectrum Pennock. We had physicians, nurses, and I think some people from community mental health who came and learned about medical treatment of postpartum and perinatal depression and mental health. So they talked a lot about how to prescribe medications for those groups, which medications are most appropriate, and that sort of thing. And then we wanted to follow up with something that was more applicable to the general service provider community that's not necessarily medical knowledge, but that could still address the problem. So the other speakers here today, we collaborated and we all fit together, so we're just going to come up here and I'm going to just quickly give you guys an overview of the data in the area surrounding mental health and pregnancy, prepartum and postpartum. So in general in the state of Michigan, based on 2015 data, 13.4% of moms experience symptoms of depression after the birth of their baby. They don't break down the data by county, but based on data from 2012 to 2014 in Barry County, we have, a second here. The region that encompasses Barry County, which also has about 9 other counties, there's about an 11% rate of postpartum depression. And then for service providers, Barry County actually does pretty well. 82.9% of women report that they've had a prenatal care discussion about depression during or after their pregnancy. So that's actually, looking at some of the other rates, that's one of the higher ones. It's pretty good. So I think providers in this area are definitely aware of the problems that are going on, and we hope that through this we can get everybody thinking about perinatal mental health. And I think some of you guys grabbed the charts that I have. I just talked about 2 of them, so you can peruse them as you wish. Sue, who's coming next?
I was thinking Nancy.
Nancy?
You want to be last?
Yes.
Okay, so it looks like Sue Eastman from Pine Rest is going to talk to you guys next.
I was really appreciative of the health department kind of taking this and running with it. It feels like my passion has always been infant mental health and postpartum mood stuff, just because personally, as a mother, when my son was born 42 years ago, I struggled with postpartum depression. So I, like Nancy Roberts, who is kind of our guru through Spectrum about postpartum depression, have a very personal experience with that. Nancy is kind of the nurse that in this Grand Rapids, West Michigan area got things started, and she had a sister whose life ended because of postpartum depression. So she's been very passionate about that. I heard a speaker this spring at Pine Rest who has done research around the world in public health matters. And he spoke about, one of the things he spoke about was helping to extend psychiatric services by educating primary care providers. The other big thing that he talked about, he spoke with a woman in part of the World Health Organization about where could you get the most bang for your buck as far as providing any kind of services in a preventative way. And they came up with mothers and babies and postpartum issues or peripartum issues, which also includes during pregnancy. So I thought that was very timely, thinking about if you want to have the most impact on a community, make sure that your mothers and your babies are healthy and safe and have the resources that they need to be strong and healthy. So I'll just talk a little bit about what Pine Rest does. Laura's going to talk about what's available for mental health, community mental health, and then Nancy's going to talk kind of in a preventative way about those people that probably Laura and I don't ever get to see, but that have very high needs as well. So think of this as what we're aware of in this community that we can do for moms and babies or parenting and pregnant moms. So there is a group of Pine Rest providers that are specially trained in the area of perinatal moods. And we have like a certification program, including some conferences and some reading and things that is required of us. And one of our agreements through Pine Rest is that we will serve pregnant and parenting moms and try to get them in within 2 working business days. So I have been very blessed to have a good connection with Dr. Woodall and Renee's office to try to help us do that, and trying to educate the other community players about that so that we can get these folks in as quickly as possible. Postpartum or perinatal mood stuff feels a little different than depression or anxiety kind of in the general population. Often there's a ton of stigma around it because these women are pretty normally functioning in other times in their lives, but can become very ill, very paranoid, very depressed. I can remember a mom saying to me a while back, I thought about leaving my family because I felt like they were better off without me, and leaving meant taking her life. So I hear stories like that a lot. So it feels like to be able to intervene and to normalize and to help these folks know that they're not crazy and that this is something that's very treatable and something they can receive services that are not going to be stigmatizing and shaming. So I also have training in infant mental health, which is kind of one of my passions from before, and that's Laura and I share that training. It's kind of a highly specialized service working with infants, moms, and children up to age 3. Is that where your population officially goes to? So just understanding that those folks have very high needs, that approaching that and providing those services as quickly and as without shame as possible is kind of our thing. Laura and I were kind of joking, we're social workers, we're not ones to do PowerPoints and things like that so much, but more interactive. So let this be kind of informal, and as each of us present, if you have questions, please raise those questions. Are there any thoughts or questions or comments at this point? Yeah?
How does somebody get referred? Do they need to be referred by their primary care physician or?
They do not. Often, Dr. Woodall's office in that practice does refer, there's a screening for parenting mothers called the Edinburgh, and it's about a 20-question screening. And many of actually I'm so proud of Dr. Rosser, because she's a pediatrician, but she realized after the birth of her first child, she said, that was hard, and I'm willing to take, as a pediatrician, the risk of presenting this screening, because one of the things that docs struggle with is, okay, the pediatrician treats the baby or the child, so you really can't bill for doing a screening on a parent, but she felt like it was important enough to be able to do that. So that's one way that that's identified with the Edinburgh, and that's a free domain screen that people can use. So just word of mouth, just docs can refer. You can, if you have concerns that you think that's the case, you're welcome to call.
Do you accept all insurances?
We accept all insurances except straight Medicaid. And that's where Laura is able to provide services for that. But yes. Thanks, sister. Any other questions? Yeah.
From PEDAC in the Family Birthing Center, we have a questionnaire that we go over with every patient, and they fill out the Edinburgh, and we put it in their chart. And when they score high, that's where you've gotten referrals that we've talked to the providers, they get hold of you, and they come to see you.
Yeah, it's
And that's
hard.
a newer thing that we do, that every patient is
Okay.
given that.
Do you feel like that's been kind of
It
an
has been.
outpouring from this community with the identifying the postpartum? Thank you. Yeah, good. And it's a very simple screening. One of the struggles with it was created in Scotland, so some of the wording is a little funky as far as it doesn't necessarily translate well, but if the provider's able to take a look at that. The question that's the most important, of course, is have you considered self-harm? So that one kind of bumps the ratio or the score up very high.
And anyone that scores a moderate or high risk, we let the providers know.
Yes, yeah, I appreciate that. Yeah, do you have a conversation with that mom at that time, or do you? Okay.
And then part of their discharge teaching is what to look for, the differences between postpartum depression and baby blues, and just for them to know that there is help.
Yeah.
And feel comfortable in seeking it.
Yeah. How many people have heard of the Baby Cafe? Okay, so there are a fair number of people. I went to their grand opening a couple of weeks ago, and that to me is a wonderful resource in this community. In fact, I bragged about it too. We quarterly get together with perinatal mood providers through Pine Rest and kind of talk about resources in the community, and I really bragged about that one because it feels like it's such a user-friendly, it's non-threatening, it's a support group that meets every Thursday from 10 till noon at the library, so it's a safe and comfortable place. And they can just get together and talk. And the lactation consultant that runs it is awesome. So, which brings up, I'm going to hand out some stuff as I'm finishing up and as Laura takes over. We have a group right now that meets in Kalamazoo that is kind of a prevention and / service-oriented group for women struggling with postpartum depression or anxiety. So I printed off information about that, and I'll just kind of make it available to people. I also have some magazines that Pine Rest produces about postpartum depression and anxiety, so I can make those available. Yes?
Can you explain a little bit about the day program that Pine Rest offers?
Yes, thanks, Karen. Yeah, at the time that we started it was one of 2 or 3 in the nation. Mother Baby is a partial hospitalization program that runs from about 8:30 in the morning till 4 in the afternoon. Weekdays, babies are welcome and encouraged to attend. We have a nursery care provider that is on staff there and will care for your baby if you need to, or your baby is welcome to be in the group with you. And it's, the criteria is simply that it also serves pregnant women, and we have had some pregnant women. They try to, like if you have had the loss of a baby, that may not be an appropriate referral, but if you're struggling with depression or anxiety, the mom that I mentioned that was thinking about taking her life, she was a graduate of that program twice, and one of the comments that she made to me, which was so amazing, was after she went through counseling in the program, she finally felt like she could fall in love with her child. So that was very powerful. And that is available for folks with insurance, but I believe that CMH also makes referrals to mother baby as well. If the level of distress of the illness becomes such that they need to be inpatient, unfortunately they can't keep the baby with them, but they will make every effort to try to help that mother find support for that baby during the time that she's inpatient. Any other questions?
Are there any services available in Barry County for mothers that have lost their babies, like at, miscarriage or even after? My sister lost hers at like 6 months, and she went through a full delivery, just like a baby.
Right.
And it was horrible, and there was not anything really available.
You're right.
To feel that grief.
There is a provider in the Grand Rapids area that specializes in perinatal loss. I myself, and I would guess have you, Laura, also done some services with moms who've lost babies. And by the way, when we use language like fetus or miscarriage or things like that, I think it's important to remember for that mother that was a baby. So that's one of the things that I come at that from that perspective is this was a child and you have the loss of a child. So yeah, does that help? And I can maybe get with you afterwards and see if I can find the name of that provider for you.
Spectrum Health in Grand Rapids, they do have bereavement services offered to moms that have lost babies.
Yeah. Yeah, Spectrum and Nancy Robbins really are the leaders in perinatal mood stuff and providing services for mothers and babies. Yeah, great question. Others? Thank you. Laura?
Good morning, everybody. Good morning. So this is a program that is really, really near and dear to my heart. For community mental health, one of the guidelines for Medicaid, and that's our primary population at community mental health, is the Medicaid population in our county. One of the stipulations that all community mental health in Michigan have to have is an infant mental health endorsed clinician. So it's a clinician with specialized training, and Sue kind of referred to that. It's through the Michigan Association of Infant Mental Health, and they have been on the forefront nationwide of just advocating for infant and early childhood services to help to support families and attachment and social and emotional health of babies. So I am endorsed with that program, and we have 2 other clinicians that are going through the process, so that is very exciting. There is lots of requirements for that as far as specialized training in early childhood development and attachment. We have consultation that is from a higher level endorsed clinician every month, so there's somebody with specialized training that can give us guidance and feedback in what to do with these cases. It's a unique population, but it's a wonderful opportunity, and I think for community mental health, it's one of the areas that we can provide more prevention. I'm sure a lot of you are familiar and maybe coming up with some frustrations about some of the changes, some of the gears shifts that we have done as far as the population that we serve. We're going back to that traditional model of community mental health, what it was set up for. So guidelines aren't changing, but we need to pull our funding into the pool that we were designed to serve. So often we have to have, a severe and persistent mental illness. That's one of the big criteria for services at our agency. And then we also have the substance use disorder side too. So this is a unique program in that we don't have to have a severe mental illness for a baby or for a mom. We just need to be able to show that there is some sort of risk factors that might impede her parenting and her ability to attach with the baby. So some of the things that they look at are the mental health status of moms. And within our own building, we have tons of moms and families that fall under that high-risk category. Maybe there's substance use, domestic violence, limited resources, mental health issues, that they already have a major depressive diagnosis. So being able to provide infant mental health services for those moms is really, really awesome to be able to do that. And it just helps to give them extra support in a very fragile time. How many moms do we have out here in the audience? Lots, yes. So we know how it affects our hormones and how we feel about our bodies and our worries about life and bringing this baby into the world and being able to give the baby everything that it needs and everything we feel like it needs. So it's a very fragile time in a woman's life. And so the guidelines that we have, and these are Medicaid-based again, we can actually open a woman for infant mental health services in the 3rd trimester of her pregnancy. So 28 weeks up to the delivery date. And that's wonderful to be able to do that because then we can get in there and really help her process her feelings about delivering the baby, and if she has some maybe experiences in her past trauma or violence where her body has been touched against her will, things like that that really start to trigger those memories and those experiences during a pregnancy anyway, but certainly at delivery time. So being able to just kind of help plan with her and crisis planning and just give her that emotional support is really awesome. And then we can work with babies up to, it's actually 48 months, so by the 4th birthday, it's not technically infant mental health, although we don't stop our infant mental health interventions at the 4th birthday. And there is a movement within the My AIM Association to expand that to infant mental health in early childhood, so up to age 6. So 0 to 6 is really the population that we fit under that umbrella. So there really are not a lot of guidelines through Medicaid, yay, for this program. Like one of the only that we don't have a lot of guidelines. So we really just can use our discretion, and I think most of the team at our agency is really good about, here's a mom, that she's pregnant, or there's a new baby, and there might be some kind of issues with bonding going on, call Laura. So, they call me, and I'm always happy to, take calls from anyone in the community. If you are working with any moms with new babies or in their pregnancy, even if it's, before that 3rd trimester mark, and you just need some ideas for support and services, I'm more than happy to take any calls about that. So as far as who we open for services for infant mental health, we can be really flexible with that too. Sometimes if it's a mom that's already been in for services, or maybe she's currently getting services, we would just continue to work with her. For babies, we're looking at normal development, just typical developmental milestones, and kind of helping educate moms about what those are. And we can can do this either in the home or in our office. So I am more of a clinic-based clinician, but I do have a few outreach cases where I do go into homes, and those are predominantly infant mental health cases. There's a lot of benefit of going into the home and seeing that environment, and sometimes things come up that you wouldn't really know about, like maybe we should find a different place for the pack and play other than by the fireplace. You know, safety things like that that maybe aren't things that moms are aware of. So for babies to be open, we have specific assessment tools that we look at, that normal development, we look at social emotional health. Are they responding when mom is talking to them? Is mom talking to them? Is she responding to their needs? Does she pick up the baby when the baby cries? Does she, kind of have the ability to pick apart, oh, this is kind of a hungry cry, or this is a I'm wet cry, and just helping to provide that education with her as well. So I have one family that I've been working with for about 3 years. She has 3 kids now under the age of 5, so we'll be together for a few more years. So, it's a really cool opportunity. I do make referrals to the mother-baby program, and I'm so thankful that we have such a specialized service in our area. It's not in our county, but we're so fortunate in Michigan to have such a specialized service. I had an intake, and she's an open client with us now, who had just had her baby, and she went to the mother-baby program when she was pregnant because she was really struggling with suicidal thoughts and just really having feelings about rejecting her baby. And what a scary and shameful thing to express, but it's very common with postpartum depression to have feelings like, I don't want my baby, or my baby reminds me of a bad thing that happened, or it's something connected with the father of the baby that is not a good experience, and I don't want to hold my baby, or I don't want to be in this world because I'm really struggling. So to be able to get her to a place where she's welcome and people understand that. And that was a very scary thing for me, actually, as a clinician, that was probably one of the more intense cases that I have had. Her baby was about 4 weeks old when she came in, and she was really struggling. And it's scary to think of the worst case scenario in that situation. But as long as we can do crisis planning, and we know that she's going to be open and honest about using those words that feel so awful to hear and to say as a mom, we can help to give her that support. And so she did go to the mother-baby program with her baby, and she was there about 12 days. So now she's doing infant mental health outpatient with me. And so that was a really great experience. So it's a wonderful opportunity for us in Michigan to have that program. And Sue mentioned Nancy at Spectrum is a huge advocate and a great support. She's always willing to take calls and questions as well. So we, on the substance use side, we're trying to just internally target, in a way, those higher risk population families too. I don't have my certification for substance use therapy, so one of the clinicians that is in the process of getting her endorsement does have her substance use certification too, so that will be a great opportunity. We're also looking at trying to provide some services for parents that are incarcerated. We can also see fathers under this program, so all that flexibility. So that's going to be really awesome. So we're looking at that population as well. How horrible would that be as a dad to not be able to be at the delivery of your baby, or to be able to hold your baby when it's first born, or within that small time of infancy. So those are some of the areas that we're looking at expanding on. So if anybody has any questions, or any moms in mind, or families, we also do, I think I mentioned the developmental screenings. So if they need referrals for early on, or there's risk factors where that seems appropriate, we do that as well. So, but don't hesitate to give me a call if you have anybody in mind that you would like some clarification on services or referral ideas. Any questions for me?
I think those are great reminders that sometimes both Pine Rest and CMH have this reputation for how do we get in. And if that's the case, Laura or I are available to try to help. Sometimes knowing the right words, knowing how to present the concerns so that whoever is doing the screening understands that. And we are always willing to help kind of pre-screen some of those to help you think of a direction.
That's a good point. Infant mental health is a good cue. We within the endorsement population are always kind of doing education on families that are appropriate for services. So any pregnant mom, as far as the Medicaid criteria there, within that third trimester and with a baby at home under the age of 3, that's a lot of families that we serve have at least one of those. So there's a lot more families that we could be providing this service, and it is prevention. Again, you're looking at giving them some education and some support to really help to grow a relationship with their babies and feel supported and to work through any, everyday living stuff that's going on as far as housing or, safety issues, things that pop up from the past that kind of trigger memories and experiences during that time. So it's a really great opportunity, and I'm very anxious to start being able to expand our services. Yes.
Along with the policy working with knowing addicted mothers, we're seeing that a lot more on our caseloads.
Are they pregnant or? We do treat in the substance use side, yes.
Yeah, actually there's a methadone clinic in Grand Rapids that serves moms who are addicted to heroin. And I believe it's still running. Part of a program that I supervised in Grand Rapids called Mission In served moms who were struggling with substances. So I know there are not necessarily specialized services here, but we can make connections for some of that.
And probably for moms that you're speaking of, it would be more of an addiction treatment firsthand. Is that right? You're seeing moms that are still addicted to heroin? Yeah, yeah. So we would look at that from substance use treatment first if there was. Absolutely, yeah, and those are appropriate too. So it's possible that we could do both at the same time, absolutely. Yeah, so keep that in mind. And as far as referrals, anyone can refer. We have families that refer themselves. The woman that I spoke of that went to Mother Baby was referred by her pediatrician. So OBs, any of you guys, anybody that wants to throw a question out. Sometimes there's shame and guilt about some of these feelings and thoughts that they're having that are not their typical thinking and feelings. So it's hard sometimes to get them in the door. They don't want to talk about it, and they don't want to acknowledge that that's happening. So we really try to kind of, in those cases where we feel like it might be appropriate, but there's some apprehension, it's like infant mental health is a little piggyback to, maybe substance use services or, the mental health treatment that you're already receiving. If they're open to, talking about their babies, we just kind of explain it really in general. If you're interested in learning more about development, or if you have any questions about that and you need some support or, different cries and things like that, you try to get something that's going to get a little bit of a buy-in. As long as they're willing to be open to conversations around those topics, then we can open them and do infant mental health
The
services.
methadone moms and the heroin addicted feel really bad for them because when they come into PEDOC, we're not able to care for these babies that have the withdrawal symptoms because they need to go to a level 3 nursery where they're able to receive morphine to help with the withdrawal, and we don't do that. So that baby will be transferred and the mom's left there at PEDOC
Right.
until we can discharge them, and
It's
it's a hard
painful.
situation.
And I think you brought up a good point as well as you did. If we have a mom, if we find out that a mom is struggling with addiction, I'm not gonna shame her about that. I'm gonna try to work with her about that. And kind of work with her where she is in her addiction. Like you said, at the time the baby is born, if that baby has the drug in its system, then that kind of requires a level of care that you're not able to provide. But Laura and I are going to be there to say, we'll get you through this.
We have moms on probation that are, CPS is involved, and I'm sure that CPS refers them to you. And there's a fine line between counseling them and holding them accountable on the criminal side. And I don't know, as a probation officer, you have to wear a couple different hats. You want to build trust with them and help them through their addiction, but you also have to hold them accountable. And only because that baby doesn't have a choice. And a lot of the mothers that you see that we send to you, they're probably not real excited about being there.
Yeah, you're absolutely right. That's a good point. And I have had experiences with Vanderbeck recently, which is kind of counterintuitive to the infant mental health work. So we have ways that we can try to work around that. If and you're absolutely right. We do have moms that are very resistant. I know everything about babies. I'm good. Leave me alone. And if there's no window of opportunity, then we leave them alone. But we certainly still kind of under the radar are trying to advocate for that. But if they'll give us just a little bit, like, oh yeah, I might have some questions about feeding or weight gain or things like that, then we try to latch on to that as best as we can. Thank you.
Good morning. I am the unconnected one. I'm from you may know us as My Alpha Place. We are going back to Alpha Women's Center because we are more than, well, people didn't know what's a My Alpha Place. So we deal with girls and guys who are thinking about being intimate and getting pregnant, up through that child's is an adult and on his own now. So we deal with that spectrum, okay? Qualifications are walk in the door. That's the only requirement we have. Our building we're located on the corner of Green Street in Cass. The big red house that the high school principals used to live in, that giant big red house, we are directly across the street, right there on the corner. Come in the back way, it's a house. It is not a medical facility. Girls walk in, we talk to them. We discuss, we take clients that have had a death or a miscarriage of any age child. That's a grief that's unknown to the rest, to so many of us. A parent should never have to bury their child. That's a child's job to bury their parent. And there's a grief that's unique there. We do not counsel, we mentor. We walk through life with our clients. Oftentimes our girls will come to us and the typical scenario, she walks in the door with the guy, I'm there with you, I'm there with you. Hormones take over, she gets cranky and mean and he's out of there. So now she's alone, she's pregnant, she may be a high schooler, she may not. We encourage her, we get them through high school. We encourage them through that line. We have kids now who have graduated from KCC, and oh, what a graduation that was. And they are now getting married. They have 2 children. He's in the military, she's a college grad. I mean, they are our poster children. We walk through, we go through delivery with, we become coaches. Some of our clients are unable, they're able to get pregnant, but they are not able to parent. And we walk through that horrible grief that they bear. While you met this mom, you would know she cannot parent, but she can still love this child. And she can't understand why she can't parent. And so we walk with that parent through that very painful situation. And she comes back for years. Traditionally, we see our clients for an hour every other week. We deal with baby blues. If we see a client that's over our head, we go to the pros. We'll call the docs and we'll say we need to get this in. Now we have numbers and names and where to call. And there are situations that we understand are greater than we are. We do not have that capability. We are all, well, I have volunteers who meet with our clients. They've all been trained. They go through a 6-week mentoring class and then shadow another mentor for another 6-8 weeks. And when that mentor feels like they can handle the case, then they will get a client. They'll meet with the same mentor every time and get a really great bond. We bribe our clients. They come in, they get 2 vouchers. With those vouchers, they can get diapers, formula, wet wipes, clothing from newborn through 5T. We have cribs, we have car seats, we have what that baby needs. For a lot of our girls, that may be what keeps them coming back. Our goal is to have them become happy with who they are, confident in who they are, understanding their situation and be a contributing part to Barry County. That they would see their need for employment, how to gain employment, how to get their child into a good daycare center, how to be that responsible part of society. We encourage them to get involved in a local body of faith, a church. Get that group of, and we have churches, they're the ones who fund us. We get no federal monies. We get no state monies. We are funded completely by the community. So that's who we are. That's what we do in a nutshell. And, got a question? I'm out of breath. So, yes?
What are your hours?
I wish they were greater. We're open Tuesdays from 4 to 7. Wednesdays from 10 a.m. to 2 p.m. Thursdays from 5 to 8. We're only open those 3 days because of staffing. Our Wednesday, we have lunch together, and that is so fun because we have moms who bring their kids, and we all sit around a table, and everybody talks and chats, and all of a sudden, they're just part of this group, and there's camaraderie, and there's fellowship and socialization. Our best referral is word of mouth, and the moms refer friends to us. So, there's pamphlets And there's these little cards on the back table that say pregnant, scared. That's not the only service that we offer. We do offer a free pregnancy test, but that's as medical as we get. And all we do is give them the box, and we have a bathroom there, and they can take their own test. We claim to have no medical services. We also have a washer and dryer. Bring your dirty clothes, girls. We'll do your laundry. We have soap. It's an expense they don't have to come up with. We do teaching. We do cooking classes with some who don't. We teach how to clean. We teach first aid. We teach parenting. And it's ongoing. So, we have moms who come back after their children have started school and they're 8 years old and I don't know what to do with them, just twitching in the corner. We have classes in bringing up boys. It's a James Dobson class, and so we go through that. Never thought of that, kind of thing. So we become moms, and we just mentor and walk with these people. And like I said, now we have dads, and sometimes it is the mom who just says, I don't want to be a mom. I want to be single. And dad has the child. He comes in. We have a couple men who will meet with our dads and do that. They need diapers too. They need formula. They need clothes. And they come in, get their stuff. So, that's where we are. That's us. Okay. Any questions?
I know that all their contact information is on the back table as well, so don't hesitate. If you have questions, they have phone numbers. Give them a call. We want to let you know that in November, which is our next breakfast, the topic is going to be food services, food health resources throughout Barry County. And in November, we are fast approaching Thanksgiving and Christmas when a lot of families struggle. So we're going to have a panel of a number of food resources throughout Barry County. So look for our invitation for our November breakfast. And thank you for coming today and have a great day.